Hello. You may have heard that many communities in the United States are experiencing an epidemic of prescription drug abuse, particularly opiate painkillers, drugs such as OxyContin, among many others. This usually shows up first in the form of overdoses, young folks brought to the emergency room in a coma and having to be revived, or in some cases it's too late to revive them. The causes of this epidemic are not that mysterious. In the first place, although they're absolutely essential to medicine, these are dangerous drugs. That's why they're controlled substances. They carry risks. They're addictive, and have been a problem really throughout medical history. There are a couple other factors that are important. One, people tend to regard these drugs as safer than street drugs, although they're acting on many of the same brain systems. They come in nicer packages as pills or capsules, and I think that fools some people into a sense of confidence. Second, they're a lot more available than they used to be. I'm told that in the last 2 decades, prescriptions for opiate painkillers have almost tripled because doctors needed stronger medications to treat chronic pain patients. In a sense, this epidemic that we're experiencing now is an unintended consequence of that increase in availability. I should define a couple of terms you may hear. Prescription drug misuse refers to employing the drug outside of its intended purpose. For example, if you use someone else's prescribed painkillers. Abuse refers to when that use causes actual problems, usually with reference to your functioning or your safety, such as operating a motor vehicle while under the influence, or taking too many of them so you stumble and fall, or even mixing them with alcohol, which is probably the most common problem and the common reason for difficulties that arise with the use of these drugs. Dependence is a medical disorder in and of its own right. It usually features tolerance, which means you need to take more to get the same effect that you used to get from a smaller dose. Withdrawal, which are flu-like symptoms such as nausea and vomiting, irritability, and of course craving or drug hunger for the drug when it's not available. If you're concerned that one of your loved ones has a problem or is misusing opiate painkillers, you can go ahead and contact the physician or somebody in the physician's office, like an office manager, and tell them what you've observed. Now, don't expect them to give you confidential information because they're not allowed to, but they can take information that you give them, preferably factuals, incidents that you've seen or witnessed that help them decide whether or not the treatment plan should be changed because of problems that are developing with these drugs. Don't forget to mention alcohol consumption because that's so often a big factor. Now, if you think you're dealing with someone in your family who has developed an addiction to the drug, it's a good idea to consult with an addiction counselor or an interventionist before you confront them because they're likely to be pretty resistant. People who have become dependent on the drug tend to panic when it's threatened. And so if you want a good outcome, it's a good idea to get some professional help first. Now, if you're dealing with an addiction, you probably will require professional treatment for your loved one. It's not something that you can deal with easily on your own or people can give up just by exercising willpower. The treatment will include alternatives for pain in situations where these drugs can no longer be used. Now, we never want to interfere with medical treatment, but medical treatment involving these drugs should be delivered in the context of full information about what's happening at home. And as a family member, you're often in a very good position to provide that information to a healthcare practitioner. Thank you.